Have you ever felt a burning or gnawing pain in your upper stomach, especially late at night or when you haven't eaten? You take antacids, the pain eases for a while, and then it comes back again. Many people ignore this or blame stress, hunger, or gas, but sometimes that pain is a warning sign. It could be a wound inside your stomach or intestine, a condition known as peptic ulcer disease, and it affects millions of people worldwide. Peptic ulcer disease happens when there is a chronic open sore in the lining of the stomach or the first part of the small intestine. These areas are constantly exposed to strong stomach acid and digestive enzymes. Normally, the stomach protects itself with a thick mucus barrier, but when that protection breaks down, acid begins to damage the lining. Over time, this damage forms an ulcer. The most common sites are the stomach, especially the antrum, and the first part of the duodenum. This condition is especially important in today's world because of how we live. Many people rely heavily on painkillers, deal with constant stress, skip meals, smoke cigarettes, or consume alcohol regularly. All of these habits weaken the stomach's natural defenses. That is why peptic ulcer disease is no longer something seen only in the elderly. It is a modern lifestyle-related disease that can affect almost anyone. Globally, peptic ulcer disease affects about 5 to 10% of the population and is more common in developing countries. It is seen more often in men than women, especially in middle-aged and older adults. Duodenal ulcers occur more frequently in men, while women tend to be affected more after menopause. These numbers remind us that this condition is common and often under-recognized. The most important cause of peptic ulcer disease is infection with a bacterium called Helicobacter pylori. This organism lives in the stomach and damages the protective mucus layer, allowing acid to injure the lining. Other major risk factors include frequent use of nonsteroidal anti-inflammatory drugs like aspirin and ibuprofen, cigarette smoking, excessive alcohol intake. At the center of this disease is an imbalance between the stomach's protective mechanisms and aggressive factors like acid and pepsin. When protection fails, acid takes over. Helicobacter pylori makes this worse by weakening the mucosal barrier and causing inflammation. Over time, repeated injury leads to the formation of an ulcer that may deepen and persist if untreated. The most common symptom is a burning or aching pain in the upper abdomen. This pain often occurs 1 to 3 hours after meals and is usually worse at night. Many people notice that eating food or taking antacids brings temporary relief. Other symptoms can include nausea, vomiting, bloating, belching, and weight loss. Some people may not feel pain at all and instead present with complications like anemia or bleeding, which makes the condition even more dangerous. If peptic ulcer disease is ignored, serious complications can occur. In rare cases, long-standing ulcers may even become cancerous. Some critically ill patients may also develop stress-related ulcers, especially after severe burns, trauma, shock, or brain injury, and these ulcers carry a high risk of perforation. Peptic ulcer disease is not just ordinary stomach pain. It is a serious condition often linked to Helicobacter pylori infection and modern lifestyle habits.